Valentine's Day to everybody. My name is Senator Erin Maye Quade. I represent Senate District 56, which is Apple Valley, Egan, and Rosemount. I'm also the mom to a 22-month-old named Harriet. There is nothing that I love more than being a mom, and especially today on Valentine's Day. But we know that there are a lot of Minnesotans who are experiencing infertility for various reasons. And today we are here supporting the Minnesota Building Families Act, Senate File 1704 or House File 1658. We know that people are experiencing infertility, and there are medical services available to them to treat it. It is a disease for some people like anything else, and health insurance should cover it, plain and simple, public and private. And so you see behind us all of the support to pass this bill, joining 21 other states who have passed similar legislation so that Minnesota can truly become the best state to have and raise your family. For me personally, as a reproductive justice advocate, this is a cornerstone piece of legislation that ensures that, along with the ability to decide not to become a parent, Minnesotans can decide to become parents and have access to health care to allow them to become parents. I myself, my wife and I, needed access to these kinds of services to just start our family, and every Minnesotan deserves that. As a senator, I have access to these services through my state health insurance. Every single person should have access to this. So I am so proud to be standing in front of this incredible group and behind this incredible group of people who've been advocating for this for so long, because this is the year we get it done. And with that, I will turn it over to my partner in the House, Representative Jeff Brand.
Thank you very much, Senator Maye Quade. My name is Representative Jeff Brand. I represent the North Mankato, St. Peter part of District 18A. I'm proud to be the House author of this act, House File 1658. I stand with a bunch of folks here in the back of the room as well, because I think that this is a matter of it's hundreds of thousands of people across our state are being impacted by this bill. And so I think that hundreds of thousands of Minnesotans, and we all have stories, and each of my colleagues have stories about this bill that we've talked about. We've shared collectively in the House, and I know in the Senate as well. There's a lot of support. In fact, because of some of the lobbying efforts of some of the people in this room today, I've also got some more authors that have signed on just today. So thank you very much. Yeah. So here's what we do know. We know that infertility is a recognized medical condition. Like cancer, we know it exists. Like diabetes, we know how to treat it. But unlike these diseases, hardworking Minnesotans don't have access to the insurance that they need when they're diagnosed with infertility. And so 1 in 7 Minnesota couples have to struggle to get pregnant or sustain their pregnancy. That's, again, about 186,000 Minnesotans. And they live in every part of the Good morning. It's okay, yes. Be loud, be proud, yeah.
Careful what you wish for.
Good point. I should also mention I'm a proud parent as well. My wife and I have 2 kids, and we enjoy every minute of being a parents as well. I've heard from many of my constituents. I've got some constituents here as well, and I just want to say that when I door knock and talk to people, or up here at the legislature, I hear from so many people across the state, including folks in my district as well, and I know it's really important. Many can't afford it on their own, frankly, and it's really unfair that couples have to try to have a child by taking out a second mortgage, like I've heard from constituents, or rely on friends and strangers for their funding their medical services. The state of Minnesota offers fertility coverage to employees and ourselves as legislators, but it's also important that we also think of our constituents, and that's part of the reason why this legislation is where it is right now. I think it's important that hundreds of thousands of families across Minnesota have these benefits. 21 states have these benefits for every citizen in the state. And I think Minnesota, well, we're not there yet, but by passing this legislation, we would be, maybe perhaps the 22nd state. So I think it's time to pass this pro-family piece of legislation. And now I would like to turn it over to Barb Kalura, the President and CEO of Resolve.
Thank you. It's not every day that we have a pacifier here in the press room, so somebody's going to want this. Mom or Dad, it's right there. Hello, good morning. I'm Barb Calora, and I am the president and CEO of Resolve, the National Infertility Association. We are a nationwide patient advocacy nonprofit, and I am here representing millions of Americans who struggle to build their family, as we've heard, including about 186,000 Minnesotans. Full disclosure, I am a native of Minnesota, born and raised in Bloomington. I'm grateful that our wonderful bill sponsors are here, Senator Erin Maye Quade and Representative Jeff Brand, and all of these inspiring advocates who are here on Minnesota Advocacy Day to support insurance coverage for the treatment of infertility. Infertility is something that 1 in 7 women in the U.S. struggle with. They struggle with getting pregnant and carrying a pregnancy to term. It's not something we always talk about, though. At Resolve, our organization, we believe that all people facing challenges in building their family should be empowered through knowledge, supported by community, united by advocacy, and inspired to act. We are here today to do just that. We are taking action to support House File 1658 and Senate File 1704, also known as the Minnesota Building Families Act. For many families, an infertility diagnosis is not the largest barrier to becoming a parent. Sadly, it's the out-of-pocket costs of that treatment. Lack of insurance coverage is the #1 barrier to care. Struggling to build a family is already physically and emotionally exhausting. The lack of insurance for needed medical treatment is doubly crushing. By passing insurance coverage for infertility, Minnesota will join 21 other states across the country to help hardworking families get access to necessary healthcare treatments. With this legislation, we can reduce the financial strain on families while only minimally impacting insurance premiums. In fact, the increase in other states where we work has been less than 1%. Because of the lack of insurance for IVF treatments, patients often resort to riskier and less effective medical treatments, which they can afford to pay for out of pocket. However, that can result in multiple births, twins and triplets, and that raises other risks, premature births and so on. Nationally, multiple birth pregnancies cost our nation $4.2 billion, more than a singleton baby. The Minnesota Building Families Act is an important step forward for the advocates who are here today and so many other future parents. It's just amazing having all these folks behind me. We are urging our legislators to support this bill and get it done. Thank you so much, and I want to introduce you to an amazing advocate, Mariah Gran.
Hello, everyone. Thank you for being here today. My name is Mariah Gran. My husband, Andy, is with me. We were both born and raised here in the great state of Minnesota. For the past 9 years, our lives have been taken over by an emotionally, physically, and financially exhausting battle with infertility. As a child, if you asked me what I wanted to be when I grew up, my answer was always a mother. So when Andy and I were newlyweds in 2015, we were excited to grow our family. We had no idea our plans would be much more difficult than we could have ever imagined. After we were unable to become pregnant on our own, we went through a multitude of tests that revealed both my husband and I had factors that led to a diagnosis of infertility. It was devastating and crushing. We were told we would need infertility treatment for our condition, but like many Minnesotans, our insurance did not offer this type of coverage, despite infertility being defined as a disease by the American Medical Association and the World Health Organization. If we wanted to be able to become parents, we were going to have to pay a costly amount for it. Still, the dream I had as a little girl remained strong, and we decided to go ahead with the treatment. Fast forward 7 fertility treatments and 7 heart-wrenching miscarriages later, we were left with tens of thousands of dollars to pay. We had to take out a second mortgage on our home. The horrific emotional pain of infertility is devastating enough. But to add on the crippling financial impact was an extremely difficult time in our lives. In 2019, we explored adoption. So often people may suggest adoption to those of us experiencing infertility. It can be a beautiful path to parenthood for some families. But often people do not know, as we did not know at the time, that that path is also extremely financially taxing and could take years. At that point, we were unsure of where to go. We had exhausted so much of our finances. After a lot of thought, and with the encouragement of loving family and friends who organized a fundraiser and helped raise $22,000, we were able to do one final round of in vitro fertilization. Never in our wildest dreams did we imagine having to have a bake sale to have a baby. The IVF round was successful, and in February of 2021, our beautiful daughter, Isla Gran, was born. And she's here with us today, and she's spunky, so. Infertility is not only a women's issue. According to the National Institute of Health, 1/3 of infertility cases are caused by male reproductive issues, 1/3 by female reproductive issues, and 1/3 by both male and female reproductive issues are unexplained. 1 in 7 women suffer from infertility, which is around 186,000 Minnesotans. We all know someone who is or will be affected with this disease. For our family, we still hope to have another child, but that may not be in our future without insurance coverage. And time is not on our side. We cannot afford to wait. Please give those suffering from infertility the family building opportunities they deserve and pass SF 1704 and HF 1658 to bring infertility insurance coverage to Minnesota families like ours who are suffering. Thank you.
Hello, I'm Dr. Chandra Shenoy, and I'm a reproductive endocrinologist and infertility physician in Rochester, Minnesota, at the Mayo Clinic. It is likely that everyone here in this room knows someone who has struggled with the devastating impact of infertility. Every leading healthcare organization now recognizes infertility as a disease and do not consider its treatment to be elective. Despite this, millions of Minnesotans pay insurance premiums for plans that neither cover the diagnosis nor the standard treatment of the disease. Young people diagnosed with cancer often have a very brief window to freeze sperm or eggs before their treatments will render them permanently infertile. Yet insurance does not cover the cost of preserving their ability to have children in the future. 21 states have infertility insurance laws. Minnesota is not one of them. In the past 5 years alone, 5 states have passed legislation requiring comprehensive coverage for infertility, and other states have had comprehensive policies for decades. Real-world data from states that offer similar coverage to what's being proposed today in Minnesota show that average premiums, the increase is minimal. The Minnesota Commerce Department estimates an increase of just 4 cents per member per day. Most of the patients I see don't need IVF or highly invasive treatment, but many delay seeing a doctor because they don't have insurance coverage, and these delays increase the likelihood that they will need more invasive treatments. When IVF is needed, outcomes are better when there is insurance coverage. Simply put, insured patients are more likely to choose a single embryo transfer, and this lowers the number of multiple births, which generates huge cost savings for insurance carriers and leads to healthier mothers and babies. Without requiring insurance coverage for infertility, the ability to build a family depends on your ability to pay. On a daily basis, I witness this inequity. Imagine how crippling paying for the treatment of other diseases would be without insurance coverage. It is heartbreaking to see teachers and nurses that can't have children because they don't have insurance coverage. Many are simply unable to afford care. Others prematurely stop treatments when their savings run out. We know stories of people exhausting themselves by taking on a second job, like working at Starbucks, just to have infertility benefits. Contrast this to people who can get access to care because they happen to work for the right employer. Amazon, Target, or even the state of Minnesota provides fertility benefits to its employees. But the ability to treat a disease should not depend on working at the right job. I've waited for years for a bill like this to help my patients. For those struggling with infertility or facing a cancer diagnosis, further delays will mean that even more Minnesotans will not realize their dreams of building a family. I believe the time to pass this bill is now. Thank you. I'm going to pass it back to our lawmakers to open it up for questions.
Questions?
Erin Maye Quade.
Yeah.
I'm wondering where you think why it collapsed last year when the legislature did mandate other insurance coverage for hearing aids, contraception, mammograms, or breast screenings beyond a mammogram. I mean, so many things. Is that a sign that this could be a hurdle that it would have hurdles to clear this year? What do you make of that?
I really appreciate the question. I think there's two parts to it. The first is that when we heard this bill in the Commerce Committee, we changed the bill to just requiring private insurance to both public and private. So we had some conversations to have with the agencies and the state about what that cost would look like before it went to HHS. One of the things I can tell you is certainly in the Senate, there was strong bipartisan support for this bill, and we see that out in community as well. But the chairs in the Senate know that this is a top priority for me, as is the majority leader, so I have a lot of confidence we'll get this done this year.
In the states that have this, do they place any limits on the number of tries a family can have?
That's a good question. Yes, please tell us.
The coverage varies across those 21 states. It can vary from a dollar limit to the number of cycles to unlimited. So unfortunately, there isn't one standard amongst those 21 states. Of the 21, 15 of them, one of those is actually the District of Columbia, they specifically call out coverage for IVF, but it does vary in states. The bill before the Minnesota legislature is very consistent with the coverage that we've seen in recent states that have passed, and it aligns with our model legislation as well.
But the one thing I can add is that people's bodies know their limits, and that's why we have it set to what the model legislation is.
And that is that there is no such limit on the amount of tries that you can, for IVF specifically.
Yeah, I think the limit is what, between a doctor and a patient and a family decide is their limit, right? It's time, it's money, it's energy, it's your body, it's your health. That's where the limits come into place. The legislature putting a cap on how many times people can try to have a child is just not something I want to wander into.
Is there any copay limits? I know some legislation mandating insurance has said you cannot pay out of pocket for this. Does this speak to anything on that sort?
Did you want to answer the question? Okay. I believe, and correct me if I'm wrong, this is tied to maternal health care, so the cost would be the same and on the same level.
Broadly, it seems like a large priority for members across the legislature this year has been decreasing costs of early parenting. Childcare has seen a proposal that's going to be going forward. Could you just, one of the lawmakers or both of you, talk about the effort to do that across the board and how this fits into that?
Yeah, so this proposal obviously is the starting point for so much of the other legislation. You have to have a child before you have affordable childcare. You have to have a child before they go to a good quality public school. We want Minnesotans who want to be parents to be able to become parents, and then once they become pregnant, give birth, and start their families, they have all the support that they need within community and from the state. And so this is just really like the first kernel that you get the popcorn bag from.
Absolutely. And to draw on that as well, I think it's really one of our interests this year to make the cost of being a Minnesotan as affordable as possible in every aspect of government. And I think that this is also one of these. I've got a constituent with me. She traveled to New York to get treatments. And think of the toll, the cost, the travel, the time, all of that time and energy involved. When we can just pass a piece of legislation where any Minnesotan can get that done affordably here in the state of Minnesota. And so I think that is definitely something that I'm interested in doing, and I know a lot of my colleagues are as well.
Can I say,
Yeah.
the reason that the reason that I went to the state of New York to get treatments was because it was the only way that we were able to afford to get IVF treatments. The clinic that was in Syracuse was actually a third of the cost of any clinic in Minnesota, and that was with travel expenses, time off from work, hotel, et cetera, all included. All of that ended up being a third of the cost. So that was the only way that we were going to be able to afford to start our family, was to travel out of state, which is not the ideal way to start our family.
Thank you.
Are all these children here the products of IVF or other infertility treatments?
Yes. Come on up.
Yeah, this is Gabriel, and he's 6 weeks old. And I also have a daughter who's almost 3. And we also had to travel to New York, and both of them are IVF babies. Yeah.
Can I say your name and spelling it for
Yeah, I'm Josephine Eads, and it's Eades. I live in Duluth.
I'm Jeffrey Hill. I'm the other end of the spectrum. We have 2 daughters from GIFT, gamete interfallopian transfer, which is an old, out-of-date technology. But our daughters are 30 now, and we have our first grandchild.
Congratulations. And my name is Mallory Kushel, and Macy and Marley are the product of IVF. And we're very blessed. I work for an employer that offers fertility coverage, and so the finances were not a barrier for us. So we're here today advocating for the same opportunity for everyone else. Thank you.
I memorably got pregnant before I was in the Minnesota Senate, and it was $12,000 to have my daughter, Harriet. She is 22 months old, and I got pregnant on the first try. I don't know how long we would have been able to keep going if we'd had to do more than one. Any other questions?
12,000 was for the treatment, not for the delivery and.
Correct, yes, not for the subsequent birth and just to get pregnant, not pregnancy or childbirth.
I forget which one you mentioned it, but you mentioned there was bipartisan support for this.
Yes.
It seems like something that shouldn't have too many barriers.
It really shouldn't. There shouldn't. I don't know who can oppose people who want to be parents becoming parents. So they can come talk to me if they have concerns. But we really hope, this is literally my top priority, and I want to get this done this year.
Does it have a yet, or?
It doesn't have one scheduled yet, but I have been in close contact with Chair Wickland and her staff about getting it done early this session.
So,
And I should speak on the House side as well. So there are 12 different health mandate bills that are being discussed in the Commerce Committee right now. And so I'm having conversations with both and they're gonna decide as a committee what bills they're gonna hear this year at the legislature. Obviously, we need to know what the forecast looks like as well at the end of February. We'll find that out if we can spend some money on very important things like this. The bottom line is that between the Health Committee and the Commerce Committee in the House, I'm working on that. So hopefully we can get something scheduled.
So some of the people have traveled to New York. You said what your number was to be able to have your daughter. If there were insurance coverage, on average, about how much would it cost per treatment? Can you speak to that?
So, and I probably can have folks who can come up more. It would depend on where you're going and what your services are. A lot of infertility treatment is information. It's not necessarily what we think of, we think of IVF often, but it can be anything from ultrasounds to I had dye put through my fallopian tubes, which I believe is the only thing my insurance coverage covered at the time, and it was $12. So I'll have somebody come up and speak a little bit more, but it wouldn't be $12,000. That's for sure.
Yeah, the price ranges widely for access to IVF, and I'm just going to talk about IVF because every body is different, and there's a male and a female. As we say, you need 3 things: sperm and an egg and a uterus, and they all have to be working and operating effectively. So that might be different medications, different procedures based on the diagnosis. And so you're looking at anywhere from $10,000 to $25,000 potentially for an IVF cycle. Medications as well need to be covered. The medications alone can be anywhere from $5,000 to $7,000 if you're doing a full IVF cycle. So I love these cost questions, but I oftentimes wonder what a knee replacement costs or what a cesarean section in emergency appendectomy. Why do we even know these costs? Because people are having to pay out of pocket. So we need to get to the point where this is health insurance, it's covered by all of our plans, and all of these folks don't need to know every penny of what that costs because it's covered.
I know how many miles they got me on my credit card.
Just to be clear, the
numbers you just mentioned, though, are what someone might be paying out of pocket for this, right?
Correct.
Right, okay.
Yes,
So
absolutely.
so it would be significantly less than that if their insurance covered most of it.
Depending on their copay, absolutely, yeah, and what the coverage is, absolutely, yeah.
I know we have the numbers for just the estimated number of Minnesotans who deal with fertility struggles, but is there an estimate for the percentage of those who do so without coverage? Because
Many. Many. I mean, we do have, there are large employers in the state of Minnesota that do cover the costs. And so, but when you look at people who are likely to experience infertility, people who need access to assisted reproductive technology, it's a lot of couples that don't have access to it. And that's why you see so many people in this room today, is because it's not a fraction of the people who are experiencing it, it's a lot, maybe most.
Can I just say, at the time that my husband and I went through infertility treatments, we had our insurance through MNsure, so through the marketplace, and that insurance provided no coverage for our infertility treatments. And so that was really hard to know that we had publicly provided insurance that we were paying for through the state, and that we had no infertility coverage through that process. My name's Bailey Dvetter, B-A-I-L-E-Y-D-E, capital V-E-E-E, sorry, D-E-V-E-T-T-E-R, and I'm one of Jeff Brand's proud constituents.
One thing I should add too, why do the larger employers in the state of Minnesota have it? It's about retention and it's about recruitment of awesome employees from other states. If we can do this here, we can keep more people in our state without having to go to other states perhaps, but also to bring more people to our state for our workforce. As the Vice Chair of Workforce Development, I'm looking at different angles to bring more people to our state's workforce. So.
Both California and New York, you will notice that a lot of their employers are offering this. I'm one of those people who've traveled to Colorado, California, and New York just to get these treatments, or I've tried to work for other companies in other states.
Any last questions before the baby's time is up?
You're good.
Thank you.
Thank you all. Thank you.